Hello, and welcome to this explainer. If you're joining us today, chances are you, or maybe someone you care deeply about, is navigating the incredibly personal and honestly often overwhelming world of fertility. I just want to start by acknowledging the heavy emotional weight that comes with fertility struggles. It can feel so isolating, right? Almost like you're trying to solve a giant puzzle without having all the pieces, but you absolutely do not have to navigate this in the dark. Today, we're going to walk through a clear, genuinely supportive guide to demystifying female fertility. We're relying directly on medical insights from ART Fertility Clinics to give you clear, reassuring answers about how the body works, what can kind of get in the way sometimes, and, most importantly, the paths forward.
Okay, let's dive into this. I want to start by looking at a number that might actually bring you a sense of immediate comfort. If you've been feeling totally alone on this journey, the global data changes that entirely. According to the World Health Organization, the global adult infertility rate sits at around 17.5%. That means approximately 1 in 6 people worldwide experience infertility during their lifetime. Literally 1 in 6. It is an incredibly common human experience, and realizing how widespread it is really reminds us that seeking help is a completely normal, everyday step for millions of individuals and couples all around the globe. But before we look at specific conditions, we need to gently establish our medical baseline. Like, what exactly does the medical community mean when they use the word infertility? Well, it's not just a feeling. It's a very specific clinical parameter. The World Health Organization defines it clearly as the inability to achieve pregnancy after 12 months or more of regular, unprotected intercourse. Having this exact medical definition removes all the guesswork. If you haven't quite reached that 12-month mark yet, it might honestly just be a matter of time. But if you have, it simply means it's the right clinical moment to start looking for answers.
To find those answers, we're going to break things down into manageable categories. Let's start with our first area: physical roadblocks to conception.
A woman's reproductive organs, specifically the uterus and cervix, play an absolutely foundational role in natural conception and maintaining a healthy pregnancy. But sometimes, those physical pathways simply encounter structural hurdles. We're going to overview 3 main anatomical areas here: fallopian tube blockages, uterine fibroids, and cervical damage. Now try to think of these not as insurmountable brick walls, but simply as physical pathways that can sometimes face a detour or blockage that just requires a bit of medical navigation.
Let's look at the first structural pathway, the fallopian tubes. These tubes are basically the essential physical bridge connecting the uterus and the ovaries. Their main job is to literally carry the egg from the ovary down to the uterus. Because conception generally happens right inside the fallopian tube, if this pathway becomes obstructed or blocked, well, the egg and the sperm simply can't meet. It's really just a straightforward mechanical disruption of a totally natural journey.
Now, moving a bit further down the anatomical pathway, let me ask a question that doctors hear from patients all the time. Does physical damage to my cervix actually affect my fertility? It's a super specific anxiety that a lot of women carry, especially if they've had previous medical procedures or infections.
The direct medical answer is yes, it definitely can. The cervix is basically the gateway. It plays a critical role in safely guiding sperm into the uterus. So if there's physical damage there, maybe scarring from a past procedure, some structural abnormalities, or past infections, it can act as a literal barrier. Because of this, damage can interfere with the passage of sperm, reduce the chances of an embryo successfully implanting, and can even increase the risk of complications later on in the pregnancy. The final structural roadblock we really want to highlight are uterine fibroids. Now, I want to emphasize a very reassuring word right up front: non-cancerous. Uterine fibroids are simply benign growths that develop in or around the uterus. They're actually super common, mostly popping up right during a woman's childbearing years. Depending on exactly how big they are or where they're located, they can physically change the shape of the uterine cavity, which is exactly why doctors check for them when assessing any structural impacts on fertility.
Let's move on and see how this builds. We're shifting our focus now from physical structures to the body's internal timing with our second category: hormones and ovulation factors.
Conception is incredibly reliant on precise timing. It's like a finely tuned clock. When the hormones that regulate this timing get out of sync, it creates a whole different set of hurdles. The main hormonal factors that can affect egg release include ovulation disorders, irregular periods, polycystic ovary syndrome, which you probably know as PCOS, and menopause.
But to really grasp when things are out of sync, we first have to understand the baseline. What exactly is ovulation? Simply put, it's the vital, amazing process where an ovary releases an egg. To give you a standard medical benchmark, in a typical 28-day menstrual cycle, ovulation generally occurs right in the middle, around day 14. This is the absolute critical window for natural conception. Understanding what this baseline looks like is essential before we talk about what happens when the timing gets unpredictable.
Which brings us to cycle regularity. There's a big difference between a regular and an irregular cycle. A regular cycle is medically defined as spanning anywhere from 25 to 35 days. If your cycle consistently falls somewhere in that window, you have predictability, which is great. An irregular period, on the other hand, is when the menstrual cycle span suddenly shifts and falls completely outside that standard 25 to 35-day range. Why does this matter so much? Well, because unpredictable timing makes pinpointing that vital ovulation window incredibly difficult, which in turn makes trying to plan conception so much harder.
One of the absolute biggest culprits behind unpredictable cycles is polycystic ovary syndrome, or PCOS. And I really want to emphasize this. PCOS is the most common endocrine disturbance affecting women. Seriously, if you've been diagnosed with PCOS, you are in vast company. It's described as a heterogeneous disorder, which is just a fancy way of saying it shows up a bit differently in everyone. But at its core, it's a hormonal issue that directly disrupts that standard ovulation timeline we were just talking about.
We also definitely need to touch on menopause. Now, unlike PCOS or irregular periods, which are disruptions in the cycle, menopause is a completely natural biological phenomenon. It respectfully marks the definitive complete stop of monthly menstrual cycles, meaning natural ovulation simply stops occurring. And that brings us to our third category, implantation and pregnancy hurdles. We always approach this next group of conditions with profound empathy because these hurdles actually occur after an egg has been successfully fertilized, and that can carry a really heavy emotional toll. These are conditions that interfere with the embryo's ability to safely attach, settle, and grow in the womb. These post-fertilization hurdles include endometriosis, ectopic pregnancy, recurrent implantation failure, and recurrent miscarriage. Let's walk through each one nice and clearly so you know exactly what they mean.
First up is endometriosis. This is traditionally defined as a non-cancerous gynecological disorder, and it happens when endometrial tissue, which is the stuff that's supposed to line the inside of the uterus, actually grows outside of its traditional location. By growing elsewhere in the pelvic region, this displaced tissue can cause inflammation and scarring. It essentially creates a hostile environment that makes it super difficult for an embryo to successfully implant and thrive.
Next is an ectopic pregnancy. This happens when an embryo successfully forms, but it mistakenly implants somewhere completely outside the womb, most commonly getting caught up in those fallopian tubes we looked at earlier. It's important to understand with gentle clarity that the embryo just simply implanted in the wrong location, in a space that physically cannot support its growth.
Now, what's really interesting and often incredibly frustrating about this next hurdle is that it's somewhat hidden. It's called recurrent implantation failure. Implantation is that critical make-or-break stage where the embryo absolutely must physically attach to the uterine wall. Sometimes, even if fertilization is perfectly successful, this vital step of attachment repeatedly just does not happen. Identifying this specific failure point is absolutely crucial for specialists because it totally changes their approach to treatment.
And finally, recurrent miscarriage, which is clinically known as recurrent pregnancy loss, or RPL. This is officially described by doctors as having 2 or more miscarriages. I really want to emphasize a supportive, totally non-judgmental point here. Reaching this clinical threshold triggers a complete physical examination by doctors to find the underlying cause. It is absolutely not your fault. It is simply a signal to the medical community that your body needs targeted, specialized support to safely carry a pregnancy to term.
Which brings us to the most important part of our explainer today. It is time to pivot from defining the problems to empowering you with proactive, real solutions. Section 4, the path to treatment.
So, the crucial point here is captured perfectly in this insight straight from ART Fertility Clinics. They state that once the exact cause of infertility in a female is diagnosed, the chances of a successful pregnancy increase dramatically. This statement should honestly bring you massive, profound relief. It proves that knowledge is your greatest tool here. The mystery of infertility is often the absolute hardest part, but once your doctors know the why, the how to fix it becomes highly, highly achievable.
The path forward is really built on 2 highly actionable steps. Step 1 is to secure an early, exact diagnosis. Whether the issue is structural, hormonal, or post-fertilization, finding that root cause is everything. Step 2 is to begin tailored treatments based exactly on that diagnosis. Medical interventions today are incredibly varied and incredibly effective. For some, treatment is as simple as taking specific medication to just fix ovulation timing. For others, it might involve corrective surgery to clear a blocked fallopian tube or remove a fibroid. The treatment is tailored exactly to the hurdle.
We've covered a lot of ground today, untangling complex medical definitions into what I hope is a clear, supportive guide. We've seen that 1 in 6 people face these challenges, so you are definitely not alone. And we've learned that pinpointing the exact cause dramatically increases the chances of success. So I want to leave you with this empowering question. Knowing that early diagnosis changes absolutely everything, are you ready to find your specific answers and take control of your reproductive journey? Remember, you don't have to guess, and you absolutely don't have to do it alone. Reach out, consult a professional, and take that powerful first step. Thank you so much for joining me for this explainer.